And good afternoon, good evening, or even good morning, wherever you are. Welcome to our Facebook Live interview today, and welcome to our discussion on health and wellness, which is a big consideration for all of us, especially during this time in history where history is literally being rewritten. So, the new normal is our topic today, a new paradigm for a new era of medicine. And in particular, we're going to be looking at the wellness revolution. And today we're talking about healthcare reform, the wellness revolution, and it provides us a wonderful opportunity for us to look at the healthcare and talk to healthcare professionals, looking at how we can actually practice prevention, promote public health, and to optimize the experience of health and well-being for all. Today I have with me Dr. Rita Claxton and Dr. Paula Walker King, both board certified physicians and authors. So we want to welcome you both. Welcome, Dr. King, and welcome, Dr. Claxton.
Thank you for having me, Dr. Trimm. Thank you.
Thank you, Dr. Trimm. It's an honor to be on this show. Thank you.
Yes, thank you to both of you. I want to jump right into our discussion today. And starting out with you, Dr. Claxton, there's a wellness revolution that is going on. And I've heard you speak about wellness and illness continuum. What exactly is that? And what is the, the relevance for just a regular Joe Blow person?
All right, thank you. So, as you know, as post-COVID, there is going to be a shift. A shifting in the way that we view medicine and the way that we treat patients. We are going to be considering what's called the wellness continuum, where the emphasis will no longer be on sickness, on hospitalizations, pharmaceuticals, but on wellness, on being well. You will be incentivized to
Mm.
get wellness checks, go to wellness clinics, and you will partner with your healthcare provider, your lifestyle coaches, so that you can reach optimal fitness and stay fit, where you can get fit and stay fit, as opposed to going to the hospital and being ill. Because as you know, the healthcare industry is now $1 trillion industry, and the cost of healthcare continues to rise and continues to escalate. And as the cost escalates, we are going to be forced, as we have seen post COVID, to a more wellness model. Because if we can become well and partner with our healthcare providers, we can get fit and then not have to spend the money that it takes to go to the
Yeah.
doctor,
Mhm.
to buy pharmaceuticals. So as we are facing the future, we're in 2020, we are looking at a paradigm shift in the healthcare field. We are shifting to wellness, where the emphasis will be on well. You will go to the doctor so that you can stay well. You will take vitamins so that you can stay well. You will take exercise programs and things to stay well, as opposed to the emphasis and the trillions of dollars that have been on sickness and disease. The paradigm and the continuum is two things: there is sickness, and then there is life. There is premature death or sickness, or there is wellness. And people are in between. And what we want to do is to have people to shift toward wellness or life. So the difference is life and death. And the final thing is that I urge you to choose life or to choose wellness.
And in a lot of instances, it is about a choice, isn't it?
Yes,
Yeah.
because the choices is what between B. I heard it said that the C between B and D, that's birth and death, is choices. So choices is what we make. Choices when you choose to eat healthy, when you choose to exercise, when you choose to meditate, when you choose to spend quality time with your family, when you choose to reduce stress, you choose life, you choose wellness. So, wellness is how we describe life: life, health, and wellness, the abundant life.
And talking about life, health, and wellness, Dr. Claxton, what is your vision for the future healthcare? Because right now, again, as you absolutely said, that the focus has been on fixing a problem. And my mother used to say, an ounce of prevention is better than a pound of cure. So you're talking about prevention. And if there were a way that we could prevent certain diseases or prevent certain maladies or prevent certain epidemics, what does your vision look like for the future, particularly as it relates to healthcare?
Well, my vision is, like I said, it is a pattern of wellness in which we seek to manage wellness at the healthy tier. The goal is to prevent disease, is to go and to look at diabetes, to look at hypertension, and look at it at a place where you don't have disease, where you do preventative screens. You go and you see your doctor and you check your hemoglobin A1C, and it shows you do not have diabetes or prediabetes. You go and you get your blood pressure checked to maintain a normal blood pressure. You check your cholesterol, as opposed to going to the hospital with a myocardial infarction, a heart attack, or a stroke, or going to the hospital to go on dialysis because you have diabetes. A wellness model is a model in which you partner with your healthcare provider, where your doctor is your friend, but your doctor is there to keep you health, to keep you healthy and to keep you well, with the goal and the overall tendency is to stay well, to get fit and to stay fit. And then these particular paradigms or these particular ideas can be carried throughout life from birth to death, where you, again, you partner with your doctor, you go annually and you go to check on how well you are. You find your healthcare problems, and then you set a goal, you achieve the goal, and you maintain the goal. So the physician's role is not to treat you because you're sick, but to keep you healthy and well. Healthy and well. It's much cheaper to eat healthy food and to exercise than it is to get to be admitted to the ICU. And then with COVID, and the thing that we've seen with COVID 19 is that people who have pre existing diseases, comorbidities, tend to do really poorly with COVID. They tend to get on the ventilator and not come off the
Mhm.
ventilator. These are the people who we saw who did poorly, and primarily minorities, because we have underlying diseases, the diabetes, the hypertension, the kidney disease. When COVID 19 comes and it's a disease that attacks the system, we tend to not have reserves or the ability to mount a response against this disease. And as Dr. Paula mentioned today, and as I'm sure she'll tell us, she'll elaborate a little further.
Wonderful, wonderful. Dr. Paula, you want to weigh in on the whole idea? What's your vision? What do you look like? What do you hope for?
Yeah, I wanted to add that, in terms of when we look at the natural history of disease and look at a construct that's very prevalent in prevention science or preventive medicine, known as Level's levels. And we know that there are three levels to prevention: there's primary prevention, secondary prevention, and tertiary prevention. When it comes to primary prevention of a disease, we really want to prevent the onset of the disease from the outset. So, primary prevention deals with risk reduction. Risk reduction. You're minimizing or you're mitigating the risk for developing a chronic disease. So here is where we will give an exercise prescription. We will do nutritional counseling. We will target all of these lifestyle measures because we know that lifestyle is medicine.
So
We know
we're talking about lifestyle considerations, helping
that.
people before the onset, or even if they're predisposed to it, to make great lifestyle decisions.
Exactly.
Give us some
Because
examples.
yeah, so first of all, so we know that in terms of optimal health, we have to eat a plant. organic plant-based diet. Our bodies are not necessarily designed to accommodate all of the animal protein and meats and the dairy products that we consume as Americans and as citizens around the globe. And so we know that a plant-based diet is actually helps our bodies function more optimally. And so one of the primary preventive measures that we would implement is, getting the diet right, because nutrition is one of the foundational pillars for health
Okay,
and
so
for having a
so
greater sense of
so for a
well-being.
layperson, give us one thing that a person can eliminate and one thing that they can add, something concrete.
All right, so one thing they can eliminate dairy products. One thing they can add exercise or physical activity 30 minutes a day.
And Dr. Claxton, one thing that they can add and one thing they should eliminate or they could
Mhm.
eliminate.
One of the things I want to mention is hydration and water. I want to encourage people to drink water, to get a bottle of water. And Dr. Trimm, you do this all the time. You get that water, drink the water daily. And then I also want to mention, as Dr. Paula mentioned, is exercise. And as because I am getting older, um, exercise is absolutely pivotal to maintaining health, and you need to find an exercise program that is consistent, that you can perpetuate throughout all of your years. And so I recommend walking, going for walks in the afternoon, and then also I recommend cycling. Bicycling is a great way to involve the entire family. You can get the kids riding, you can go on date nights on rides, you can do bike tours. There are a lot of things you can do, but it is something you can do at a 90-year old. As a 90-year old, you can cycle as an 80-year old, or you can cycle as a 4-year old. So exercise is important to get the body movement. We were created to move. The body requires movement, kinetic movement,
So this
body
is
movement
really
with.
good, Dr.
Uh-huh.
Claxton and Dr. Walker. We talked about primary, and I'm going to come back for the intermediary and the tertiary. I'll come back to those two. But since we're way out here, Dr. Claxton, you mentioned cycling, and you're a cyclist. So I'm thinking about exercising as a way of encouraging people to take their health into their own hands and being really proactive with that. I'm not sure if we think about cycling though. So, what role does cycling have in the wellness revolution, and how can cycling be used to get fit and to stay fit?
Well, cycling is a great way. Well, as you know, that through many, many, many world pandemics and world crises, the bicycle has emerged. It was actually created in 1817 after a huge volcano in 1817, where the world had global warming and there was worldwide famine and loss of life. That's when it was created. And then after world wars, whenever there's pandemics, when people cannot ride public transportation, then the bicycle has emerged as a source of transportation, but it's also a source of exercise
Mhm.
because it is a very inexpensive way. You can purchase a bike for $90 at a Walmart and you can ride and you can get sustainable exercise. You can get an indoor cycle and ride in the home. So it's a great way. It is a lot. It will allow you to, for children who are social who are sheltering in place and who are learning at home, they can get out of the house by riding their bikes.
Mhm.
People who want to maintain social distance but who want to get out, they can ride their bikes. So the cycling revolution is good. And also the bicycle was there when women were seeking to get their right to vote. The women rode their bicycles and they got out of the houses and they went to the polls, and then the rest was history. So I'm a member of the American League of Bicyclists, and we're helping to create a bicycle safe America. And I recommend cycling because it really is a way to release endorphins. Being outdoors is natural. The sunlight is a natural anesthetic. So
Yeah.
when you get outside, the sun is good for you and the children. Also, cycling is aerobic exercise, so it helps us to decrease our risk for heart disease and strokes and cardiovascular disease. So, and then finally, bicycling and cycling heals the earth. It allows us to not ride and decrease carbon emissions so that we can ultimately heal the earth. We heal ourselves while we're healing the earth.
That's really, really good. And I'm always pushing for walking paths as well as cycling paths. When you travel, especially in Europe, and the Netherlands in particular, they've thought about it and they have cycling paths all over. And you see not only businessmen and businesswomen, women cycling, but children, they cycle to school. And so you see a lot of boats, but you see a lot of cycles. So I do agree with that. And I live in Georgia. So, I'm hoping that someone that lives in Georgia could really begin to push for those walking and cycling trails that should be a part of connecting us to a more healthy lifestyle. And I do know that there are some communities that have considered that, but I'm praying that there will be more that would join in on this whole wellness revolution.
Yes.
I agree, Dr. Trimm.
Yeah.
And on that note, Peachtree City is one city in Georgia that was intentionally built with fitness and health in mind. And so it's got all of these biking trails and walking trails, and you've got healthy eateries distributed throughout the community. No fast food restaurants, gyms on almost every other corner. So that intentionality has been applied to a city in Georgia. So if only that can be duplicated throughout the state of Georgia and really duplicated across the nation.
Yes,
It's wonderful.
and I think that we or someone starting the whole wellness revolution it would be just epic for us to bring that front and center stage.
Oh
And
yeah.
now there's major industry shifts that are going on that are demanding this kind of lifestyle. And post COVID-19, nothing is the same or will ever be the same. And paradigms are shifting as well. It's not just industries, but paradigms are shifting. And as we are witnessing the transition to new healthcare paradigms in medicine, Dr. Paula, explain why these shifts are necessary. And can you continue on in our conversation with the primary, the intermediary, and then the tertiary um, uh, effects that medicine it has when it comes to these kinds of paradigms?
Sure. When we look at the reason this transition is necessary is that number one, America is one of the richest nations on the planet Earth. However, the prosperity does not necessarily translate to better health outcomes for its citizenry. And so, what we know for sure is that for the last several decades, heart disease, cancer, chronic respiratory illnesses, stroke, diabetes and accidents, they have been the killers, the number one killers of Americans, year in and year out. The common denominator between all of those illnesses is that they are preventable. So we know that we're expending lots of money on healthcare, and we're spending lots of money on per capita, on each citizen. However, we are not the healthiest people when we compare ourselves to other wealthy countries.
That's
We're,
interesting because usually we will choose convenience over health.
Mm.
oh, very much so. And
Hmm.
and so part of that, choosing that convenience, we have compromised our health and longevity in the process. So now it's time to get back to basics. We know that what we're doing currently is not working. The health and medicine industry represent $1.4 trillion of expenditures. However, people are living longer in the US, but they're sicker. They have more disease and more disability with that lengthened lifespan. So, what can we do when we look at some of the other wealthy countries or comparable nations? We can actually learn from some of their lessons. For example, I don't want to paint the US healthcare system as if it's all bad, because there's some things that we're doing well. We treat heart attacks well, we treat strokes well, we manage and mitigate post surgical complications better than most countries. When it comes to cancer, the most common cancers, the mortality rates associated with the most common cancers are lower in the US compared with comparable nations. So there are a lot of things that we're doing right. However, there are some major areas for improvement that we can borrow some of the wisdom that has been applied or learned from wealthier nations, some wealthy nations that are our sister countries. For example, the disease burden of the United States is greater than any other peer country. In terms of the hospitalizations from preventable illness, we lead the pack in hospitalizations from preventable illnesses here in the United States. This whole notion of using the emergency room in lieu of regular medical visits or regular medical care is a phenomenon that's primarily seen in the United States. We don't see the same thing in other industrialized nations. And then, lastly, when it comes to an adult having quick access to a doctor or nurse, we see that is more readily available. That individuals in other countries, they have quicker access to doctors and nurses than adults do here in the US. So these are areas that we need to improve upon. And so, with this wellness revolution that is imminent, no longer is it, aspirational, something that we will theorize and talk about, but it is imminent because we know that the system is fractured, is broken. And now the remedy is getting back to basics, getting back to the prevention, the pillars of prevention. So to pick up with the intermediary preventive level is known as secondary prevention. And that is where we will detect and treat disease even before it's symptomatic. The tertiary level of prevention is an area that we really do really well in terms of the U.S. medical system, because the tertiary level of prevention really centers on preventing the progression of disease once it has become symptomatic. So we will palliate symptoms at this level. We will, apply medical treatment so as to slow or curb the progression of a chronic illness. So tertiary prevention we do very well at. Secondary, we're just okay. But primary, we don't do anything in terms of primary prevention. And so when it comes to lifestyle modifications, I said this statement earlier, and I'll say it again, that what we now know is that lifestyle is medicine. It used to
That's good.
yeah, it
Yes.
used to be that we thought the theory was genetic determinism, that the genes determine everything. The genes determine your health outcome. The genes determine your longevity or your lifespan. But what we now know is that it's not all in the genes. The genes represent about 30% of the equation. 70% is in your hands, is what you do every single day, what you choose to eat, what you choose to drink, if you mitigate stress, if you choose to live a balanced life that is full of, quality relationships, if you engage in work that is meaningful and in alignment with your purpose, all of these factors and indicators are contribute to that 70% that leads to better health and a sense of well-being. So
Great.
with this wellness revolution, we now know that just getting in to, jumping in at the tertiary level does not yield optimum outcomes. We've got to jump in at the primary level of prevention
Yeah.
and subsequently the secondary level of
I'm
prevention.
going to repeat it again. My mother always used to say, Cindy, an ounce of prevention is better than a pound of cure.
You got it.
Yeah,
Mhm.
and back then it didn't mean much because when you're young, you're manic, and you take for granted your health.
Yeah.
It's not until you are presented with these symptoms that you
Mhm.
really begin to take health seriously. But I think that the whole idea of prevention is a big one, and the wellness revolution is going to be tantamount to our future, to the future of individuals, the quality of life within our communities and families, and basically preventing things
Mhm.
that can be preventable. So I wanna tread into some deep waters for a moment. So talk to us about this political push by the current administration to overturn Obamacare. In
Mhm.
the interest of Americans, particularly as it relates to the wellness revolution, is this an advisable measure? I'm throwing it out to both of you.
Mhm. But
Absolutely.
yes.
Okay.
So,
Okay,
Dr.
Dr.
Trim, I just also wanted to just piggyback also on what Dr. Paula said about how we do medicine. As post-COVID and as we move into this century, we're going to see more telemedicine, more of us being on the computer, interacting with your physician from your home. You're going to see more concierge medicine, a medicine where you don't rely on healthcare insurance, where you can purchase a hospital or a physician visit like you would buy groceries, like with a credit card. There's also going to be more of direct primary care as well as learning for physicians. Part of physician education will be on telemedicine and televised and our conferences and our continuing medical education. So one of the things that we have seen with COVID is that we have to use the airways, the computers. We have to be able to reach people in ways that we've never reached them before. We
Mm,
have to extend our arms as physicians so that we can reach people. A lot of people in rural areas, a lot of people in the inner city can't make the trip to the physician's office. So I think telemedicine has been birthed. It was birthed out post COVID. And you're going to see most people interacting and partnering with their doctors by way of the computer, by way of the telephone. And then also the lifestyle coach. We're going to see an era where a patient partners with their physician, and the physician and they're going to co-write a plan for their lives. They're going to create a vision for their lives throughout their lives, and they're going to write the script, and then they're going to make the adequate choices, and they're going to choose how they want medicine, and they're going to choose the things they want to work on through lifestyle coaching. So part of the wellness revolution is also the lifestyle coaching, more coaching, but people are going to have to be more responsible for their own outcomes. And we're seeing the emergence of more autonomy in medicine. Not the doctor that says you go home, you take your medicine. It's the patient who says, I want to feel better. What can I do to feel better? And they're going to ask these valuable questions that they have posed to us through your website. Things about what can I take? What do I need to do? And how can I get fit and stay fit?
thank you.
Yeah, and if I can just add, I want to tackle that loaded question that you asked Dr. Trimm about the repealing of Obamacare,
Mhm.
what's more specifically known as the Patient Protection and Affordable Care Act, and everything that Dr. Rita just mentioned will is encompassed in some of the accommodations that landmark legislation houses. For example, when we look at so-called Obamacare, for the first time, it covered preventive screenings and preventive care. And most of the insurance doesn't kick in, remember, until there's these tertiary level symptoms that have emerged. And so, in terms of primary prevention, secondary prevention, the Affordable Care Act, although it's not a perfect piece of legislation, it does allow for preventive care services to be covered. It
So
also allows
hold on 1 minute. So if it's repealed, it means that we go back to the old.
It go back to the old, and these will become out-of-pocket expenses for the Americans that depend on Affordable Care Act. So that means that they probably won't. There was potentially will be a delay in some of the screenings that are the hallmark of secondary prevention. There'll be a delay, or they probably won't present for the nutritional counseling or the exercise prescription or the patient education that speaks to lifestyle modification. So all of those aspects that we've been talking about that really give rise to wellness and an optimized sense of well-being, these services will no longer be covered, and they will be out-of-pocket expenses, and more than likely will leave us right where we have always been, grappling with these persistent chronic illnesses, spending $1.4 trillion on these chronic illnesses and seeing no overall improvement.
So
And
we know those of us that are critical thinkers, we already know that illnesses and sicknesses and disease is a business.
absolutely,
Yeah.
absolutely,
And then also another point is that healthcare should be affordable, which means it should be accessible to people of all ages, all backgrounds, and those with pre-existing illness. And this is the type of healthcare that we need here in America. Also,
absolutely,
one of the provisions in the Affordable Care Act is quality care, where you are allowed to get physicians that are board certified and that exercise safety and quality measures, where systems are monitored for safety and quality. That is another aspect of that particular healthcare model. So, what we want to do is we don't have to name it Obamacare, but there does need to be quality, affordable, and accessible healthcare in America.
absolutely,
Call it whatever you want to. And I think that that is the point that you're raising, Dr. Trimm, is that we
right,
do not want to abandon these particular aspects of healthcare where people are able and are entitled, and in America should have quality care, accessible care, and affordable care,
right.
regardless
Quality,
of their.
accessible, and affordable.
It's quality, exactly. All three of those are covered by so-called Obamacare. And
Yeah.
so I love what Dr. Rita said. We can rename it, but the legislation and the provisions that it allows for absolutely need to stay in place for the overall benefit of Americans. And so we solve access issues, we solve the quality of care issue, and we, solve the prevention issue. And this is important because now we're at COVID-19 in the midst of this pandemic, and everyone's now talking about health disparities and how, people of African American descent are more, are having, poor outcomes from COVID-19 illness. These health disparities have always been in place. They've been persisted over time.
Hmm.
However, these are the drivers that the legislation, addresses. The lack of access to quality health care. That is the driver of these health disparities. The lack of prevention, the lack of preventive screenings, that is another driver or contributing factor to these health disparities. So if we want to put a spotlight on health disparities, and we
Hmm.
really have the resolve as a nation to do something about these disparities now that they've, been illuminated for all the world to see, then again, we need to keep a legislation like the Affordable Care Act and the provisions that it encompasses in order to mitigate or close the gap with these disparate outcomes that
Yeah.
we
And I
witness.
love your word mitigate, you know. Even if we cannot eradicate it, we can at least mitigate it. There's
Hmm.
a lot of people that send in questions, and this is for both you, Dr. Claxton, and Dr. Walker, uh, from our last discussion. And for the next few minutes, I'd like to ask you a couple of these questions for those that have been viewing. Question number one: what is the golden rule for maintaining good health?
The golden rule for maintaining good health is balance. The key to life is balance. And
Mm,
so we have to do all things in moderation. So we've talked about a plant based diet. And even with that nugget of truth, that nugget of wisdom, there is some margin. So 80% of the time, you need to be eating primarily a plant-based diet with adequate water intake, and let most of your foods come from fresh foods, foods that are alive, fruits and vegetables, and the whole gamut in terms of the pigmentation. The more darkly pigmented the food is, the more vitamins, minerals, and antioxidants
mhm.
those foods contain. And so when we look at a plant-based diet, eat like that 80% of the time. You got a 20% margin for you to have the occasional sweet or to have the occasional serving of lean meat. So there is some leeway there, but the key to life is balance. The
It's
key to
all
life is to
balance.
do all things in moderation. And so our bodies are not designed for excess of anything. Even a good thing. Too much water can be problematic, right? Some called water intoxication. We see that as a problem. Washing out, our electrolytes. And so too much of a
You're
good
taking
thing.
vitamins, you're taking electrolytes, and then you're washing them out. So
Yeah, yeah. So
it's balance.
yeah, so it is possible to have too much of a good thing too, so we all things, do them in balance. That's the
Yeah.
one golden rule, but then there are other corollaries to that rule, where we have to be balanced in all areas and making sure that we're securing adequate sleep. I mean, I've been teaching wellness for, several years now, and I'm always amazed at how little sleep people get. But in terms of our neural biology and how our nervous system functions, we nourish the nervous system when we secure adequate rest
Mm.
for the bodies. Our bodies, our hormones are regulated, while we are sleeping and resting. And so there's so much, there's a particular hormone, two hormones, leptin and ghrelin, that have a lot to do with appetite regulation. And when we don't get adequate sleep, those hormones,
Ghrelin, the ghrelin is going to start growling.
you got it. You got it. The ghrelin starts growling. And then we find we have these runaway appetites. We're always snacking, we're always eating, and we end up over consuming calories. And that leads to the gaining of weight. And
And a
so
lot of times
this is
it's
important.
empty calories, isn't it? It's empty calories.
Yes.
So, it's
Mhm.
making sure that you get the right kind of calories, because usually people who want to lose weight, they calorie count, but they're still eating empty calories, you know?
Hmm.
And this takes
Exactly.
me to my next question. What are
Can
the
I
best?
add, can I add one more thing there, Dr.
Yes,
Trimm?
throw it in, throw it in.
And let me just throw this in about hydration. That's why it's so important for adequate hydration, because as we get older, the thirst mechanism wanes.
Mhm.
And so oftentimes we will confuse our thirst for hunger. And so whereas people are eating all the time, really sometimes that's your body's cry for water.
Yeah,
And sometimes the signals get confused. And so hydration is very, very important, along with tending to all of these other areas.
that's
And
really
then, and
fabulous.
then I wanted to add exercise is another key. You want to make sure that you're exercising 30 minutes a day, 5 days a week. So
Mhm.
150 minutes of exercise a week is standard. You do not have to over exercise where you do 5 hours a day. Moderation, balance, just as Dr. Paula said, but you want to make sure you incorporate exercise.
Thank
Mhm.
you so much. Best
Mhm.
vitamins. What's the best vitamins? And they're asking from the context of the pandemic, but I would say, what are the best vitamins to take, period?
I recommend that everyone take a good multivitamin and multi-mineral supplement. So just a good daily multivitamin, multi-mineral supplement. And that should be the foundation. And then if you do anything else, in terms of boosting immune system health, we know that vitamin C, it appears at about 1,000 milligrams of vitamin C per day is the sweet spot for keeping the immune system functioning at an optimal level. But you'll get that in a good multivitamin. But vitamin C is also an antioxidant. Zinc and selenium, other minerals that have antioxidant capacity and immune strengthening effects. So foods that are that are deeply pigmented, like blueberries, raspberries, blackberries, all of those are high in the minerals that I mentioned. Pomegranates, so pomegranate juice also rich in some of these nutrients. So we want to eat foods that are high in vitamin A, vitamin C, selenium, zinc, and magnesium. These are immune supporting nutrients, and you can get those in a good daily multivitamin, multi-mineral supplement.
So people that work inside primarily, they go in before the sun is fully up and they come out of their workplace when the sun is going down. What vitamin? I know you're going to say D, but
So
Vitamin D,
vitamin
I
D.
want
yeah,
I want you to be able to say it. I'm not a medical.
Yeah, so vitamin D.
yeah,
My
And
vitamin,
then,
recommendation would be vitamin D.
yeah.
yes.
And you bring up a good point. We work inside. So vitamin D is made when our skin is exposed to the sunlight, and we tend to wear long sleeves a good portion of the year. So our skin, and we wear pants, and so our skin is not necessarily being directly exposed to the sun in order to synthesize that vitamin D at optimal levels. And then when we are out during the spring and summer months, we tend to put sunscreen on, which also, sort of diminishes the skin's ability to produce vitamin C in higher levels. And so we're inside, we're wearing long sleeves and long pants, we're covered up, we're wearing sunscreen, and we're doing all these measures that oftentimes, you're right, Dr. Trimm, that vitamin D. We can't find, if we did a nutritional profile on
Mhm.
most adults, they probably would be deficient in vitamin D.
And then I'd like to also add that with the children and sheltering in place, because most people have been confined to the home, vitamin D supplementation is very, very important, not only to the adult but also to children. So you want to make sure that your children are getting some supplements of vitamin D as well. If they've been in the home, they're not out doing their baseball, their soccer, the things that they do in the natural sunlight. You want to make sure that they're getting adequate quantities of vitamin D as well.
Thank you.
Right. Yeah.
Thank you so much.
And I would just add that the supplements is going to be very, very important because there are very few foods that actually have vitamin D naturally occurring. That's why you'll see it added to cereals. You'll see vitamin D added to milk, and you'll see it's in liver. So for those that eat liver or take Thai liver oil, you'll get some vitamin D. But there's not a plethora of food sources that actually have vitamin D. You can also see it in some canned fish like sardines that also have vitamin D. So because of the limited dietary sources that are rich in vitamin D, supplementation becomes even more critical.
Yeah, go outside and consume some sun, basically. Get some sun on your skin. And you don't have to bake in it, but get some sun in your skin. When we were growing up, we ran around and I have high melanin. And, nobody in our community ever suffered from skin cancer, the high melanin. And we grew up in the sun. We played in the sun.
Mm-hmm.
And so, we need to go back out in the sun, playing in the dirt, going out in nature, and really enjoying the outside. I think
Yeah.
some of our houses is making us sick. Open
Yes.
your windows. If you can, if you're in a safe environment, You
Yeah.
know, open the windows. I opened my windows today to let fresh air in, cut
That's
off the air condition, went outside, walked around, you know, just breathing in the fresh air will help you because a lot of the allergies that we are suffering from can be traced right to our homes, all the cleaning products, and it's locked in and being recycled. Open your windows,
Mm.
yeah, if you can.
you're
So,
right.
what can people with asthma and allergies do to strengthen um, their respiratory and lung function in this short-term COVID-19 emergency times? And this is really coming from those that are asking questions. They want to know what can we do.
Well, one of the things that you want to do if you are a person and you have seasonal allergies, that is, you have the ragweed and all the things that you typically have seasonal allergies, the allergic rhinitis, you want to make sure that you take your usual allergic rhinitis treatment that you do every spring. So if you take the Claritin or whatever medication you take, you want to make sure, especially during COVID, because the symptoms of hay fever produces body aches and fever.
Mm,
And a lot of times that can be confusing, and you can think you have COVID because you're having a sneeze, a cough, and a lot of the symptoms. So you want to make sure you're controlling your allergies during the COVID period because it makes it very difficult to distinguish these symptoms when the common symptoms associated with allergic rhinitis and seasonal allergy is fever, cough, sneezing, and generalized body aches and runny nose.
mm.
Hmm.
Thank you. Here's a question. Do masks really keep us safe?
Yes, they do. And so the short answer, yes, masks do protect us. They protect us. Well, they protect us and certain and place a barrier between us and clouds of virus particles that may be circulating in the environment. And so there are some people that can be COVID-19 positive, but yet asymptomatic. And so what wearing a mask does, it, protects people, although the individual may be asymptomatic, it keeps them from shedding those viral particles and uh, predisposing someone who's more susceptible to the development of the illness from actually coming in contact with the
Mm,
coronavirus microorganism. And
I
so,
like that.
yeah.
It keeps it out and it keeps it in.
It keeps it out and keeps it in. And so, you got to wear the mask. And I've just been seeing, so many reports across the country where people are protesting wearing the mask, or they feel like that there's an infringement on their civil rights. And really, it's about protecting yourself as well as protecting others. It's a courtesy to protect those that are more vulnerable than yourself. Yet, most of us, I have a healthy, robust constitution, but that doesn't necessarily apply to someone else who may have an underlying illness. And so I wear a mask, to protect, them as much as I am wearing it to protect myself.
That is so good. So, talking about the virus, how exactly is the virus affecting people with lupus, SLE, who are actually taking hydrochloroquine? This is one of the questions they're asking.
Well, if you're a patient,
Hydroxychloroquine, excuse me,
mhm.
hydroxychloroquine.
Well, if you're a patient and you are under the treatment of a rheumatologist for systemic lupus, and you are on hydroxychloroquine, you are to maintain those medications. You are to remain under the care of your rheumatologist and to take those medications as prescribed. The some of the patients in some studies have found to have some protection from well, some of the lupus patients have benefits from hydroxychloroquine. But if you're are prescribed hydroxychloroquine by your rheumatologist,
Mhm.
stay on the medication for the lupus, because you don't want to allow a flare up of your lupus or your rheumatological disorder during COVID, because again you will have symptoms, fever, body aches, and a lot of these symptoms, they look and feel like COVID and can be really confusing. So if you are a lupus patient, and if you have been prescribed hydroxychloroquine, we recommend that you stay on those medicines as advised and recommended by your rheumatologist. And also, while you're on these medications, your QT interval, which is a thing that is measured by EKG, should be monitored, because some patients who take high dose hydroxychloroquine have been known to have arrhythmias and some QT intervals, which is one of the reasons why it fell out of favor for treatment of COVID 19.
Wow, wow, wow.
Mm-hmm.
So listen, I can go on and on. This has been just amazing. There are more questions that are coming in, and I'm looking forward to a time in the future that we can continue our conversation. So, last statements that you would like to make to those that are viewing. Last statements. This is, we're talking about the whole idea of a new paradigm for a new era, the wellness revolution.
Well, first of all, I would like to say number one, wellness is no longer an option. We must advocate for wellness and for optimized well-being. And we are going to be the champions of wellness. And so we have got to begin to look at lifestyle as medicine. We've got to begin to see movement as medicine. Dr.
Mhm.
Rita talked about exercise earlier. We've got to begin to see movement as medicine. Our body, we're 70 to 75% water. And if water sits still and stagnant, then all types of microorganisms and algae grows in that water. We've seen swamps. We've seen water that's stagnant. Well, the same thing, our body's waters, they're designed for movement. So we've got to see movement as exercise. We've got to see lifestyle as exercise. And we've got to come to grips with the notion that wellness is no longer an option. It must become something that we operationalize. Second of all, we must continue to strive for health equity, where we close the health wealth gap, where those that are economically and socially disadvantaged are the ones that are persistently having the poor health outcomes. So we've got to, we know about health disparities. It has, reared its head again in this COVID-19 crisis. So what are we going to do about it as Americans? What are we going to do about it collectively as the healthcare system? We must make it an important agenda item to
Mhm.
close the health wealth gap. So as the rich get richer and the poor get poorer, or the gap between the haves and the have-nots, stays persistently wide, we still must find ways to, close that gap so
Mhm.
that we can make more even healthcare outcomes for all people, for all of Americans. And so those are two things that I see as important, and just embracing this wellness culture, which is imminent.
Thank you,
And
Dr.
then I would like to just echo what Dr. Paula has said, is that lifestyle is essential,
Mhm.
and wellness is absolutely, it is the new paradigm. It is the new construct. It is the new normal. And it is important to realize that most of the diseases that we encounter now are modifiable. Modifiable means they are things that we can choose to change. We have to take our health care as our own responsibility. We have to take responsibility. You have to know your blood pressure. You have to know your blood sugar. You have to know your cholesterol levels. You have to make an effort to partner with your physician. When you go into your physician, there are certain things you should ask them, there are certain things you should know. You should work with your physician as a partner with the healthcare physician to develop a wellness program. You have to realize that you are creative. and you are brilliant,
Mhm.
and you have the ability to create a plan and a construct for exercise and for nutrition. Yes, food is medicine. Yes, vitamins are medicine. Yes, movement and exercise is medicine. So, as you are now faced with this illness wellness continuum, there are two ends of the spectrum. There is premature death, and then there is wellness. You have to make every effort to stay well, to get well, and to stay well.
What a great way to end our discussion. You have been listening to Dr. Paula Walker King and Dr. Claxton. They're both board certified and they're both authors. I want to end on this note with you giving them a way to connect with you on social media and how do they purchase your books? Give them the title of your books and then how can they connect with you?
Okay. I am I can be reached on all social media platforms at Dr. Rita, DRRITA MD, drritamd.com. And my book is also on my website. It is called Just Ride.
Mm.
And you can reach me on all social media platforms at username Dr. Paula MD. That's DrPaulaMD. My website is drpaulamd.com. You can buy my best-selling book, Lead Well. It's called Lead Well: 7 Dimensions of Wellness for Women in Leadership. You can buy it on Amazon and other retailers, but also at my website, drpaulamd.com.
Thank you so much, doctors. It's been a pleasure. And we look forward to sometime in the future, uh, re engaging you for this needed dialogue. Thank you once again. And to everyone, thank you for joining us. Have a great day. Be safe, be happy, be healthy. Goodbye for now.